Center for Native Nations collaboratively created a land acknowledgement that we want to share with you now. So we respectfully acknowledge our responsibility to the original and current caretakers of this land, water, and air, the Cahuilla, Tongva, Luiseño, and Serrano peoples. Today, this location is home to many indigenous peoples from all over the world, and we are grateful to have the opportunity to live and work on these homelands. And I also want to acknowledge, since I'm not in Riverside right now, that I'm on Ahachiman and Tongva land. So today we want to share with you the knowledge of Claudia Davis and Marla Hunter, facilitated by Michelle Burroughs. And part of this effort is for a specific call that the Center for Health Disparities Research is having. So the Center for Health Disparities Research is a center that aims to develop a rich and interdisciplinary collaborative environment for training and performing health disparities research infused with community engaged research methods into the academic culture. And we're really focused on equipping investigators and communities with the tools that they need to address the health disparities in the Inland Empire. So today, the Center for Health Disparities Research and the Center for Healthy Communities is excited to collaborate with Marla and Claudia in this conversation. So with the ongoing violence that our Black communities are experiencing and the ongoing health disparities, the most recent of which is the higher incidence and mortality rates for COVID-19, we need to do something more. And we all know that these are not individual problems, but they are structural problems, and they are problems that we can change. So the Center for Health Disparities Research team decided that we needed to provide explicit funding that can help contribute to the change that is required. So one of our funding opportunities, and I'll share my screen with you here so you can see it, the special focus here is on a new funding opportunity on structural racism. So you can see some of the interests that we have, research on structural racism on or in health, structural racism in health research, research specifically on anti-Black structural racism and its relationship to health, and research on any of the broad range of social and health policies that either facilitate structural racism or seek to reduce it. These are just some of the things that you can think about in terms of the proposals that we're interested in, but there are many other ideas. One of the things, though, that we wanted to really bring attention to is that we didn't want to see race as a variable. Oftentimes we see research that compares different communities and, who has worse health disparities or not. We wanted this to really go in depth and think about the upstream, think about the social determinants of health that are really creating the disparities that our communities are facing. So this is really the call for us. And this is, today's conversation is our contribution, albeit small, it is a contribution that we want to build on and continue to make the kinds of changes that are necessary. And you can, Catherine can put the, the website up there for you so you can look more at that specific opportunity. We also have other funding opportunities, if you wanted to share those real quick, Catherine.
Sorry, so we have also an interdisciplinary research working group where we provide support for group activities, preparation for proposal, basically in preparation for a bigger proposal, or we have opportunities for graduate students, and where we have the continuity collaboratory fellowships to provide the opportunity for graduate students to receive community engaged research training and mentorship. And we also have the fostering interdisciplinary research early stage, the first training, which is basically an opportunity for early stage researchers to get funding to start a research project. And all of these projects have a community engaged research component. So,
Right.
and finally, we have also the pilot interdisciplinary collaborative research grants, which follow the same concept.
Yeah, thank you, Catherine. So these proposals are due November 6th, but as I said, today's conversation is really to help us get more depth into the structural racism questions that we want to attend to. So we are so excited to have Michelle Burroughs facilitating today's conversation. Michelle Burroughs has an MPH, and she is the Financial Administrator Officer for the for the Social Medicine, Population, and Public Health Department in our School of Medicine, and she is the Deputy Director for the Center for Healthy Communities. She leads the CHC in promoting community-based, community partner, and population health research, addressing health disparities and inequalities in communities of color. Prior to joining UCR, Michelle was the Director of Health and Evaluation at Orange County United Way. In support of the FACE 2024 strategic plan, she led efforts in developing and advancing United Way's 10-year health goal to increase the number of healthy youth by 1/3. She created United Way's evaluation plan for each community impact area in education, financial stability, health and housing, and providing measured progress toward intended outcomes. Michelle has garnered broad experience as a public health professional, and she knows everyone in the community. Every time it's Michelle, can you help us find somebody? So we just love all the work that she does, and she brings so much joy and passion to the work that she does. And so she's been, she's had her public health career for over 15 years, collaborating with diverse organizations to solve complex problems that face our counties, cities, school districts, private and public and nonprofit sectors that we're all facing. And she's just the perfect person to be doing this work. And so thank you, Michelle, for facilitating today's conversation. And I will turn it over to you.
Thank you. Good afternoon, everyone. And thank you so much, Dr. McMullen. I really appreciate the opportunity to be able to moderate this conversation. And I thank the Health Disparities Research Center for seeing the importance and the necessity in, using our platform to be able to provide this opportunity to our campus community to address structural racism, like you said, in some small way. Today, our esteemed panelists are Ms. Marla Hunter. She is the founder and president of Live, Love, Teach, LLC, a global educational consulting firm. She has worked with many global organizations and presented to numerous leaders to create more inclusive organizations. Marla is an expert in providing training in diversity, equity, and inclusion with a focus on unconscious bias, cultural competence, inclusive leadership, women's advancement, authentic leadership, and allyship. She's a first-generation American with Jamaican parentage. Marla Hunter became an international educator and celebrates diversity, fosters equity, and supports inclusion. She is aware that diverse backgrounds and voices of communities represented in collective make us stronger and better equipped to make positive impacts globally. It is Marla's ultimate goal to challenge whiteness and to even challenge white supremacy in all its subtle and overt forms. And to also counter xenophobia and longstanding cultural biases that place certain countries and cultures above others. She is hopeful that this tide is turning and urges that our eyes be fixed on diversity, equity, and inclusion for all. Thank you, Marla, for joining us. Dr. Claudia Davis. She's Associate Professor of Department of Nursing at California State University of San Bernardino. She has earned her PhD and master's degree from UCLA and her undergraduate degree in Niagara University in New York City. Dr. Davis' program of research focuses on improving breast cancer survivorship outcomes among racial and ethnic populations. Some of these findings were published in her peer-reviewed journals, including the Journal of Cancer Epidemiology, Biomarkers, and Research, Journal of Psychosocial Oncology, and the Journal of Transcultural Nursing. Within our local community, Dr. Davis serves as a vice chair of the board of directors at Community Hospital of San Bernardino. She's worked in the field of oncology as a bone marrow transplant nurse for over 32 years and has worked at Cedars-Sinai Medical Center and City of Hope National Medical Center with cancer patients and their families. Last week, she received the American Association for Cancer Research Minority Faculty Scholar Award in Cancer Research, and in 2019, the NAACP Freedom Fund Award for Health. Please join me in welcoming our esteemed panelists, Ms. Marla Hunter and Ms. Dr. Davis, Dr. Claudia Davis. Our panelists will start with doing a 5-minute presentation. So I will start with Marla first.
Good evening, everyone. Thank you, Michelle, for the wonderful introduction. And I am so glad to be here. One of the things that Michelle brought out is that I'm a global educator. I recently just moved back stateside from being international for the last 6 years. Where I was in educational leadership for American international schools and U.S. embassy schools in China, Nigeria, and then the UAE. While working abroad, diversity, equity, and inclusion became a big topic for me, especially working for organizations where many of the faces that you see in charge are older white male. And therefore, their hiring practices and their behaviors were pushed to the side, or they were the same. That's who they were hiring. So therefore, I would do things within the local community and with local people working on different cultural biases and things of that nature. And then I decided last year that the work is great abroad, but I need to come back home and do the work as well. So I returned in August and I've been doing this work. And honestly, I've been doing this since 2007. It's just that with the prevalence of everything that is happening now, people are seeing that this work is needed more and more each day. So as I was telling Dr. McMullen earlier, that yes, I have a regular 9-to-5 job where I work with educators every day. But in my heart belongs to DEIJ, which is diversity, equity, inclusion, and justice. So that's a bit about me. And I'll turn it over to Dr. Davis.
Thank you so much. So I absolutely appreciate the warm welcome. And I think what's really nice to see is that everyone is here as well. And there's a desire and an interest to learn the most that you can to address these health disparities, right? And just briefly, because I'm mindful of time as well, I worked with many cancer patients, but two in particular were two African-American patients at Cedars-Sinai. One was a dancer and the other one was a actress. And these ladies had breast cancer. And at the time I thought for sure we're going to have a cure for breast cancer, and we really didn't. And I was determined to find a cure, realizing that there was no cure and I couldn't do that, I found out that there are other areas of breast cancer that I could explore. Initially, it was health beliefs, because I felt that, as some studies have suggested, that women don't see themselves at risk for breast cancer. And so I did some research on health beliefs, but more importantly, I found out in working with community members and breast cancer support groups that you do have survivors. And in particular, African-American women are surviving. And so I wanted to capture their survivorship. Some of my work has talked about the meaning of survivorship for African-American women, but more in particular, there are some issues with regards to their survivorship trajectory. They're at risk for comorbidities, and how does that really play out? So I dug a little bit deeper and started getting involved with cancer survivorship groups and do some collaborative work with them. And they have really informed the work that I do, and I'm happy to be here. Thank you.
Thank you both. I want to start out by asking you both, how can research address structural racism in health and healthcare? Don't fight over the mic, ladies.
Did you want to go, Dr. Davis?
Sure. Oh, yeah, absolutely. So when I, as I think about this, how can research address structural racism in health and healthcare? Well, one of the first things that I start thinking about is, what is the research that's being done right now? Who is doing the research? And what are the findings, right? So some of the individuals that have done a lot of research on this particular area on, how to address structural racism, I think of, and there's no bias, I'm just gonna say I'm just sharing what I know. So I think of Gilbert Guy at UCLA. I think of Chandra Ford at UCLA. I think of David Williams at Harvard. And these are the individuals that really have been talking about structural racism for many, many decades upon decades. And so one of the ways to do that is to really dig into the literature, right? And see what are their recommendations, right? So most of the time in the literature, they're stating, what are the gaps that need to be studied, right? Or what are the recommendations for future research? And since these individuals have been studying this for many, many years, and these are just a few that I've mentioned, but there are others, you have to try to dig deeper in the literature and find out what are their recommendations, what are the gaps that need to be addressed, how do you propose to study this? And I imagine that there may be some seasoned researchers as well as some that are brand new. And so it's nice to delve into that literature, because it can give you some opportunities to look at potential areas that you might be interested in. And I will stop here and pass it on to Marla.
Thank you, Dr. Davis. Just piggybacking off what Dr. Davis says is, as far as going deeper, researchers can only do so much unless people report. And that's one thing that people are sometimes afraid of doing, is reporting. And studies have shown that individuals who report the experiencing of racism, sometimes they exhibit worse health than people who don't report it. Because a lot of times when you're reporting it, that comes with writing everything down. That comes with speaking out about it. And a lot of times those are stressors. And the issue is that when things are reported, people think that's one and done. And so therefore, I don't need to get any help with it. And I can just compress it and forget about it. And therefore, there's nothing to go on. And so researchers have a hard time with sometimes finding the information that's necessary to figure out why structural racism or blatant racism is causing such health disparities in BIPOC people, and that's Black, Indigenous, people of color. Because, with health inequalities among racial minorities, they're very pronounced, they're persistent, and they're pervasive. Racism is one of these inequalities. And therefore, you know, racism is organized and it's a social system. And sometimes we forget about that, in which this dominant racial group has these certain ideologies of inferiority. And so therefore, a lot of times when people are experiencing things, some want to talk about it like we're doing right now, and others don't want to. And so therefore, you all as future researchers have to dig. You have to dig deep. You have to have these interviews, making sure that you have reliable sources, making sure you're talking to the right people, make sure you're connected with the right people, so that you can figure out, why are people of color being affected the way that they are?
How would you encourage these, did you want to say something? I'm sorry.
Yes, may I add something to that? Please, if that's okay?
Absolutely.
Thank you, thank you. So just on what Marla has said too, and then honestly, this whole center, right? So it works, my understanding is that it is a community centered focus, right? So I would say also, just to piggyback with Marla, is to ask your community partners, you know, what are their experiencing, right? Because then you're collaborating together and you're finding out their experiences from their standpoint as being members of the community, right? And so you want a partnership with them so that, in fact, the research that you're doing is guided by them. And they live in this community, and I'm sure that they might be able to enlighten you on certain areas that you have to do a deep dive on. And I'll stop here.
Okay, now you both mentioned partnering with the community and how essential that is. How do you establish rapport and relationship with communities of color that, you know, are often not included in research, and we're not often asked those critical questions? How do you lend yourself and get out there in the community, you know, to start engaging in developing these relationships?
One of the things is you can't be afraid. A lot of times I have people ask me, what do you prefer to be called? Black, African American, Jamaican American. I'd rather be asked than for people to assume. And a lot of times that's what it is. People have these unconscious biases or these assumptions about what is taking place. And one of the huge thing is social media. Social media plays a huge part on what it is we see and how we interact with people. Take Facebook and Instagram, for instance. They're all based on algorithms. If you're used to seeing something, or you click on something and that's what you interact with, that's what you're going to continue to see. If you're constantly going to groups where people think like you, that's what you're going to always see. You will never see anything different. So I recommend people to ask. And it all goes back to, it's not what you say, it's how you say it. Because people are very sensitive at this time. So even with people's sensitivity, they still want to talk to people about it. So it is very important that you ask those hard questions. And not only with that, don't come to the table empty-handed. There's Google. You can Google a lot of things. I see a lot of people laughing, but it's true. A lot of times people come and they ask certain questions that if they had just put it in, they would have found the answer that they wanted. So those surface level questions, Google can help you with that. But if you want to dive deeper, at least have something to go on. And that is a problem that a lot of people are having. They have nothing to go on and they refuse to do the research. They want somebody to just give it all to them. And that's tiring. It really is. So as you all are going through and doing this work, you need to take a deep dive and look at within yourself first. Think about whatever your unconscious or conscious biases are, and then do some basic research before you begin asking certain questions.
So to echo Marla's point as well, I would say find out who the stakeholders are in the community. But before you do that, bring your authentic self, right? And so it might be a different, you might be passionate about health disparities, but then you might say, well, how would I reach out to a particular community, right? You'd want to, I would say, be honest and open and say, I'm looking at these numbers and the stats don't look too well, but I really want to help, right? And so you're putting your best, if you will, out there to show that you're really committed to helping and you're actually wanting to work alongside this individual. And you're showing that you care and that when you report the findings, that they also are included in that process, right? You don't just get information and then leave, but that there is some ownership and there is some collaboration there. And there's a lot of work to be done. And so I think that if you put forth that you have that passion, but also that you are authentic and you are committed to addressing these disparities and having that social justice piece as well, I think that people will be open to working with you because the work continues.
One more thing. So the word ally and allyship has been coming up a lot, thinking that people, in general, we think that it refers to people who use their privilege to act in solidarity with oppressed people. But I will tell you this, we no longer need allies. We have enough of them. What we need are co-conspirators. That's what we need. We need people to be in there with us, doing the work with us, not just standing beside and saying, okay, I know that I have this privilege or whatnot, and I'm here and I support you. No, we need people to get in the muck and mire with us and to do the work with us and speak out about it. Because really anybody can be an ally. And so therefore, while you're doing this work, you want to stand in true solidarity with someone or with the people that you're wanting to help. And that means getting dirty with them too. You're muted, Michelle.
Sorry, Dr. Davis, you mentioned being authentic, showing up and being your authentic self. And then Marla, you just said, be a co-conspirator. We don't need any more allies. So if I am wanting to work with a particular community that I don't look like that community, give us some tips on how we can be effective in engaging communities that, I don't really know a lot about. I'll do the research, but I don't look like them. How can I engage them?
Like Dr. Davis said, by talking to your stakeholders, that's a big thing. Recently, I became the director of membership and inclusivity for the San Jose Women's Club. It's one of the oldest women's club in the country, period. And being a part of it really, I'm one of the youngest, and I think there's only 2 Black women a part of it. But because I am now a part of it, I can stand up and start speaking about certain things that the older women, white women, were very afraid to talk about. Not only that, yes, it is hard seeing that there is an issue, knowing you don't look like the other people that the issue is taking place with, and trying to figure out what to do. That's okay. Own that. But also own the fact that you want to do something. So that means you have to start somewhere. Look at the organizations that are in your community, that look at their missions, look at their visions. Do you agree with them? Do you personally stand for what it is that they are standing for? And if you do, send them an email. A lot of times they also have town hall meetings that they have, especially virtual ones now. Show up for one. Go and be seen. And after a while, they'll see you there. Show up and just participate. That's how it all starts out. Like, you don't have to be, especially if you're an introverted person, you don't have to be in the main limelight. If you're a background person, that's fine. But because there's a lot of work that can be done in the background. It just means that when you see these organizations, email them, ask them what their different committees are, what it is that they're doing in the community, and how you can be involved with it. Tell them where you attend school, what it is that you're wanting to do, and use your schooling as your reference and as your buy-in, because you all are needed.
Dr. Davis, do you have anything to add?
Yeah, I think Marla covered it quite nicely, but I also think too that sometimes there is that level of trust, right? And so some folks are you can't deny individuals when there is an issue of trust. And so you may find that someone might feel more comfortable and might want to share their experiences with someone that looks like them, right? At the same time, you might find where, as Marla said, you're in the fight, so it doesn't matter. So I think you have to be mindful, and you just kind of have to pick up on the folks that you're working with, and understand that that is a true issue.
So how would you encourage community members? Say I'm just a regular community member. How do I engage researchers so I can be a part of research projects?
So I know that UCSF does this. They have a Center for Community Engagement. I may be off on the actual nomenclature, if you will. But they do have events for community members to come and join and learn, if you will. And so in this virtual environment, I think that might be a route to go. But first you have to really find out what are the key indices that we want to explore. Is it going to be, for example, diabetes, right? What are the social determinants that we're going to explore, so that you can invite those individuals so they could come to the table. I think that it takes some work. It's not just an email. It's building those relationships. I think that's key, so that people feel comfortable, and that they understand that you have some skin in the game, and they have some skin in the game as well.
You all there are several journals that put out things all the time. There are researchers that are always asking for community input. And a lot of times we see the same faces over and over again. And I know I get tired of seeing those faces over and over again. And I'm sure that if I'm tired of seeing them, that a lot of you all are tired of seeing them too. And the reason why is because a lot of times people they don't know where they fit with all of it that's going on. I'm sorry, somebody's car alarm is going off. They don't know where they fit with everything that's going on. So one of the, and I know you all have heard the term, stay in your lane. I know my lane. I know what it is that I'm comfortable with. So I know when it comes to certain things, I know what Marla is going to be comfortable with and working with. DEIJ is one of those things. Now, if somebody's talking about statistics and what, I am a math lover, but I don't like stats. So I'm not going to deal with it. However, I know that I'm going to need help with it. So therefore, I'm going to reach out to people that I know that enjoy doing stats, or like we're in a panel just like this, there is somebody within the chat that may be listening, that may be saying something, and you reach out to them as well. For example, the New York Times wrote an article, and it was entitled "Race and Medicine, the Harm That Comes from Mistrust." Because of that article, and again, you know, you see who wrote it, they give their byline, they also give their email address. There are people that reached out to them within research that helped add some things to that article, especially when it came to Black male and health outcomes and their mistrust. So a lot of times when you see articles and you see things that are written by people, there's always some way or another you can get in contact with them, especially if it's something that you enjoy. Send them an email, DM them, especially if it's all on social media, because in this time, people are more likely to respond to you than ever before. So this is the time where if you as a community member want to be involved with these things, when you see something and it sparks your interest, if there's an email there, if they listed all their various social medias. Another thing, LinkedIn. If you all are not using LinkedIn to your advantage, you need to do so. LinkedIn, by far, hands down, is the place to be right now, because there are so many community groups within LinkedIn where these discussions are being had with people from all over the world, where then you can be seen and then be working with these people as well and doing research projects. So if you want to start somewhere and be serious about it, go to LinkedIn. And just look at the feed and see what's happening, because everyone is talking about it.
May I add something to what Marla is saying as well? I'm thinking about just, the time that we're in right now, right? And I'm thinking about issues, and yes, Black Lives Matter, and that's a given. Social injustice, that's a given. And I imagine, as Dr. McMillan said, that, these are suggestions for proposals, and she's on point. And I would take it a little step further, that you might want to think about what is passionate for you, right? you might be interested in. For example, when you think about reproductive rights, right? And when you think about reproductive rights with Latino women, and you think about one of the great documentaries, No Más Las Bebés, and you think about what's happening now with ICE, and you think about how women, in particular Latino women, are being taken in and having these surgeries and not really agreeing to that, right? And so if that's an area that you're passionate about, then I would definitely see how you could link up with an organization so that you can align your research if you're dealing about reproductive health. I deal with cancer disparities. I deal with health disparities with the African American population. So that is my particular area of interest. So I ask you, I just flip it around to say, what are you passionate with? And what is your interests and desires? And then seek out those organizations so that you can ask those questions, because it all begins with a question, right? That's research. So you have an opportunity to really align yourself in what you're interested in and then going forth there.
Yeah, that was great. I was going to ask you both what advice you have for the panelists. I mean, what advice you have for the researchers that want to work on structural racism in health and healthcare. And you gave a great example to, just think about where their areas of interest are. Are there any other things that they can do to, kind of get their ideas flowing and identify ways in which they can address structural racism in the healthcare industry?
So that topic is it's very broad. And as Dr. Davis stated, that you need to look at what you're passionate about. I would like to know what in the chat, put down what you all as researchers, what your passion is, so that we know where to start. And especially since we're all in a group right here, I don't know if everybody knows everyone, or if you all are in passing, or if you've all passed or had classes together or whatnot. Right here, this can be your little connection right here as well. Listing what it is that you're passionate about, that you plan on doing, where you want to start your research with, and then connecting with someone right now who is on that same lane that you're in, because that's one thing that's very important. As Dr. Davis said, yes, figuring out what it is that your passion is, then taking that passion and looking at organizations or other people who have that same passion that you do, and then working together to figure out how you can do the research together as well.
We have a couple of things in the chat. So it was mentioned that Dr. Priya Batra does research on forced sterilization at IEHP. And she's an expert in, this area. So if you're interested, reach out to Dr. Batra. And then also Dr. Osei mentions she's interested in adverse childhood experiences as it affects childhood development and behavior. So keep some more coming. Let's talk about this. I think this is a great opportunity. Like Marla and Claudia have stated, that, you can develop your own networks and community just within this, this discussion, and, find some synergy and alignment, and maybe work on a research proposal together to address structural racism.
So Dr. Osei, I'm reading what you said. That's right up my alley, because I am in K through 12 education. That's what I'm dealing with every single day. Childhood experiences and how we go from that and working with, and how it's affecting their everyday childhood development and behavior, especially with distance learning right now. It's a lot. It's a whole lot. So that is right there. That is my passion. That is what I work with every single day, every day.
Yeah, I'm glad you mentioned that, because we are seeing it in practice. We are seeing pre-adolescents and adolescents having a really hard time, and especially in my Black and brown children, it's been really, really tough.
Are there any questions or comments? This is a discussion, so we want everybody to engage and feel free. You know, if you have ideas, let's throw them out there. Let's kind of talk about it and see how we can work together and collaborate. And like I said, I know that Dr. McMillan is looking for some rich proposals to be submitted. So let's use this as an opportunity to, you know, kind of, like I said, start cultivating ideas.
I think
So,
you're muted.
oh,
Sorry.
okay, so I just wanted to add that thank you, Marla and Dr. Davis, for being here. It's really nice to get to meet both of you. But I also wanted to add that with everything that is going on, UCR School of Medicine has established a thread in medical education that is focusing on health equity, social justice, and anti-racism. And so we're making sure that our physicians that are graduating from our school, because we see this as a basic thing, right? You cannot be a physician if you're not versed in these things, right? So one of the things that we're hoping to do is to have these dialogues and storytelling and conversation series with our community members. So it's just so refreshing to hear you say that, and also makes me like, yay, we're on the right path. I'm getting this done. And Michelle here is working with us in connecting us with community members. So what we're trying to do is have our students listen to their stories as they interact with the healthcare system, and begin to see things from their perspective. You know, and I'm so glad you said that, Marla, about asking people what they want to be called, how they want to be addressed. And that's one of the things that hopefully we can get our students to learn, and our faculty, me, myself included, because oftentimes we walk into the room and we assume, you know, you're Black, so blah, 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 blah. Well, we have to stop and ask, what name, what is your name, and how do I call you, right? So thank you so much for saying that. It was just really good to hear that coming from the experts in the field.
I'm so glad you brought up names, because that is very important to me. And as you all are doing this work, it's especially in the medical fields, you are going to see people that come in, and I see it every day in education, that come in with names that you may not be able to pronounce, or names that you may not understand. I implore you all to learn how to pronounce them, because that's a person's identity. Names are very important. And depending on your culture, your name may not have been given to you at birth, but there may be a whole naming ceremony based on your behavior, or based on what it is that your parents may have seen for you or want for you. So when you are dealing with others, or your patients, or you is dealing with research and all of these things, names and how someone identifies themselves is very important. So make sure when you're doing this work that you are taking the time to actually get to know the person. And that goes back to what Dr. Davis said as trust. Whenever I talk to someone, I want to know who they are as a person, and I usually start off with their name. and getting the history of their name. And a lot of times just getting that background information opens the door and gives a segue to some deeper conversations that probably would have never been had before.
So I'd like to, if possible, I believe Dr. Moses had written something in the chat, and I just wanted to just highlight that for a moment, if that's okay, Michelle. Can I? Yeah, okay. So what she said was her interest of the cumulative effects of the lack of medical care on the lifespan of Black women and the epistemology of trauma. And I think an area that needs to be explored to address some of the questions on what can students or what can faculty or others explore is something called that intergenerational lag, right? And that intergenerational intergenerational drag. And what that means is that you have folks who are in particular generations. It's hypothesized that they're in a particular generation, and the effects or the lifetime effects, that cumulative effect, is transferred from one generation to the next. So this is something that's really hot in the area of systemic racism. And I might implore you to start looking at that intergenerational drag as a concept and explore that hypothesis a little bit further, because I think there's evidence out there that shows this cumulative effect, and it goes on from one generation to the next. And so, this might be the start of a, you might want to do a pilot study before you start looking at some constructs and some further questions to dig deeper. But that's an area, to your point, Dr. Moses, that needs to be explored. How about that? I'm passionate about that. Okay, thank you.
Any other questions or comments? I know we're coming to the end.
I would just, could I say something? I'd just like to say that, first of all, I really have appreciated this. And this question has come out of my own experience in my own family. Seeing what happens to my aunts and my grandmothers on both sides, and women who are just keeling over when they have so much more life left in them. And I just, it comes from my own background that I want to know the answer to this question.
Excellent. Thank you for sharing that. So I might want to share that some of the work by Ford and G at UCLA, they've talked about this. So just to get you started, and it's nice because that's what we started this discussion, right? That you talk to community members, right? And we will look at this as a community, right? And here you are sharing your personal experience, and there's actually a hypothesis about the intergenerational drag. So you are on point here, and you're talking about that qualitative lived experience, but man, do we even have to dig deeper if we want to address this systemically, right? And if we want to start looking at those factors that contribute to that, right? So I applaud you and thank you for sharing, and I feel that this might be an area of interest for many. Thank you.
Can I just share thank you so much, Marla and Claudia, for being here and talking with us, and even giving us some of the basic courtesies that we should know that we do when we come to people and share time with them, asking their names, where they are, what they're doing, and I'm always I'm fascinated by the need to continue to be reminded of those things always. The other thing that's striking me is the conversation on intergenerational trauma, adverse childhood experiences. I've been doing work in historical trauma. Honestly, it's the first time I've heard of intergenerational drag. So there's a lot of different literatures coming at this question. And I feel like we have a lot of people in the Inland Empire who really are passionate about this question. And so I guess I just want to acknowledge that there's a lot there that we can do together. So thank you.
Any other questions or comments? You guys have been a very, yes, Deidre, please.
Hi, good evening, everyone. My name is Deidre Reyes. I'm a fourth year, currently attending the University of California, Riverside, and my major is public policy. I wanted to thank you guys for this opportunity. I'm still an undergraduate student, so I know that none of what you said applies to me as of yet, but this was really great insight to prepare me for my next steps. I don't have a big sister. I'm a first generation student, so I don't know what's next after I graduate in 4 months. So that's the reason I'm here today with all of you. And I just want to thank you all so much for your insight, taking time out of your day to educate us about the work that you're doing. And I took a lot of really great notes, so I'm looking forward to meeting and working with you all in the future. Thank you.
Deidre, I want to say that don't think about it that it doesn't pertain to you, because it does. All of this, whether you decide to go into the field of medicine or health or wherever it is that after your undergrad career you choose to do, all of this pertains to you. So don't ever feel like that, especially a conversation about race or diversity and equity and inclusion or anything like that, doesn't pertain to you, because it always does, whether you feel like it does or not. But this is for you, because you don't know how you might not use it right now, but you can use it later on. But it always pertains to you.
Thank you, Dr. Hunter.
And I might want to add as well, Deidre, thank you for sharing that this might spark a particular area of interest, right? Someone might need to have an undergraduate working with them. There might be the potential for collaboration. And so I always say, keep an open mind, right? And definitely reach out to us as well, because we're here to support everyone. Thank you.
Thank you, Dr. Davis.
Any other last questions or comments before we end our discussion today? No? Okay, well, I would like to thank you all for participating. Ms. Marla Hunter, we've been on other discussions together, so thank you so much for accepting the invitation. Dr. Claudia Davis, I adore you, and I'm just so thankful that you were able to lend your perspective coming from a research perspective to these, to everybody that's on our Zoom call this evening. And I just think that this has been a great discussion, and I hope that it's provided some type of insight and has generated ideas for future proposals that will truly address structural racism. And I want to leave you with these few remarks. As James Baldwin wrote, not everything that is faced can be changed, but nothing can be changed until it's faced. So I would challenge and encourage all of you to go out and be the change that you want to see. You have so many wonderful opportunities that are presented here, and this one in particular is being presented. So I look forward to hearing about the wonderful projects and proposals that are submitted to address structural racism. Thank you so much for joining our discussion and conversation this afternoon. And I hope that this just is the beginning of many more to come. And thank you, Dr. McMullen, for having us all and putting this together.
Absolutely. Thank you, Michelle, for facilitating such a fabulous conversation. And Dr. Davis and Ms. Hunter, thank you all for sharing and opening doors for us. We so greatly appreciate it. Gratitude, much gratitude to you. Everyone, have a beautiful evening. And we look forward to seeing terrific proposals, as Michelle said. and be in contact with each other. We've got some really good synergies going on. So let's foster that and let it grow. So thank you again.
Everyone have a wonderful evening. Bye.